Hello everyone, thank you for joining us today at our University of Gdansk for Open Day. And here I'm going to introduce you guys to our 3D printing lab. I'm a medical student, sixth-year medical student who has been involved in 3D printing for the past couple of years. And I've had the great opportunity to learn about 3D printing, all its capabilities, as well as its amazing ability to both create something new and develop something just completely out of your own mind. We've been using the process to try to learn more about heart anatomy, but the applications range from basically everyday utility, where you want to build something that you've broken at home, all the way to building hearts and models for prosthesis, as well as for designing and better understanding the anatomy of the human body. So the process itself is kind of very complicated, or not too complicated. If you understand how a printer works, it's more or less the same idea. We have a couple of machines here that I can show you, and each one has its own design process. So what we have here, just to make life a little less complicated, is essentially a printer. And we have a print base that we'll show you a bit later. And on that, we have a printing head, just the same as a normal printer. And what ends up happening is material will be extruded from that print head and will be fed through that print head, just like ink from an inkjet printer. There we go. And as it gets heated, this material melts a little bit. And once it gets extruded from the print head, this material melts and deposits on the print base, which is over here. An example of that, print base is just like this one. And we have a partially completed print over here. And so material gets deposited layer by layer on here. And as the print head goes down, it deposits a little bit more and a little bit more of each layer. And hopefully, eventually, assuming that the print completes and doesn't fail at any point, we will eventually have something like this. So using this material right here, we send a set of instructions to the machine that eventually prints out something as cool as that. So this is an example of one of the hearts we printed out, and I'll show you different other examples of that as we move forward. So this is one example of how the printing machines work. However, this isn't the only way we have to actually print our models. There's another method which actually uses one of these orange looking machines, one of this one or this one. What ends up happening is we have a liquid layer at the bottom, and we have our tray that prints, or rather the print bed, is actually inverted. And so what ends up happening is we dip the tray bed into the liquid, and we have some UV lights that cures the material onto the print bed. And what we can do is actually cure something that can be transparent, so something like this. So as the print bed rises, we have material that gets deposited on the print bed, and it essentially kind of appears out of the liquid and out of the ether. And as we raise the print bed, we then raise the, the Z-axis, and we end up printing more and more material as we cure it and as we raise the layer. Now we have more sophisticated machines. So one of the things that we can also do is print in two different materials. So this is, as you can see, kind of like a soft material and very pliable. And over here we have a much harder material that's a little bit more resilient. And so there are lots of different types of materials you can print with. Some that are, like I said, flexible, some that are transparent, any color you want, multicolored. So your imagination is kind of the stopping point. On here we actually have two print heads. So you have two materials in here, and what ends up happening is one is a support material. So as a result of the complex nature of the structure, sometimes the print can fail. And what's important is that these supports be there so that as you print, you have something to print off of. And sometimes it can be a bit tedious to try to clean something like this up. So what we do is we have a print material that we want the actual end result print to be. And we have a material that can be dissolved. So one of the print heads prints with the dissolvable material, which is all these supports, and the other is the actual material we want to end up with. And so what ends up happening is we take that design and we end up putting in kind of like a sonic bath, which ends up melting the material and dissolving it. And all we're left with is the end product. For example, something like this, without all the supports. And that's a little bit about the design process and the actual way these machines work. There's a lot that goes into creating the machines, creating the designs, and depending on what you need to get done, we both create the design process as well as take hearts from patients and then take the DICOMs, which are kind of the picture files, and use those picture files to create our 3D model. With that 3D model, we then clean it up a bit because it's never really perfect when we export it from the DICOM. And that cleaning process is an artistic process, let's say, where we have a kind of a 3D model on our computer and we clean it up by removing the parts we don't need and keeping the parts that we do want. So it's a little bit of artistic design that goes into that process. Once we have that completed model, we then export that into another program, which divides the model into different layers, which is kind of a process that the printers will then understand how to print. So each of these layers are traced out by the code of the printing software. And as a result of that, tells the machine how to layer and place down material. And we end up with something like this, something very complex, but something the machines can understand. So I think that's a little bit enough right now about the initial introduction about 3D printing. And we can introduce Dr. Szary, who will talk to you about how this initiative came about at the Medical University of Gdańsk.
I am Jarosław Meyer-Szary. This is our 3D printing lab in Medical University of Gdańsk in Pediatric Cardiology department. We've started more than 4 years ago and we started very simple. This was our first printer that we had and it was standing just at the doctor's desk, just next to the usual printer that we use on everyday basis to print patient files. So this is how we started. We printed models that really amazed us and opened our eyes how this new technology can help both the doctors and the students to better understand anatomy of complex congenital heart diseases. So most of the models that we've printed, and it was more than 70 I think now, are upstairs at the department. But this is a copy of the very first model that we did. It's a 3-year-old boy with coarctation of the aorta. This is narrowing. That was the problem of this boy, and this was the very first model that we've done. Later on, we've done many different experiments on this technique and what it can help and what it can do. So we tried models made up of 2 different anatomical parts, like the cardiovascular system printed in white here and the trachea printed in a different color, to show how the congenital heart disease of the great vessels affects the trachea, how it compresses it. It's a case of vascular ring that needed surgery. So this model was also used to plan surgery. This is another model. The diagnosis was made prenatally as the baby was born. MRI and CT were done. So we not only use different colors, but we use different modalities in some cases, like CT and MRI, to make the best model possible. So cardiovascular system is best shown by CT, and it's printed in red here. And the tumor that was obstructing the vessels was printed in white, and it was scanned in MRI to best show the tumor, because in CT it wasn't so much visible. And Soon after the model was made, the baby, still being a neonate, needed surgery, and the model was also useful to guide the procedure. We sometimes print 2 models for one patient, like in this case, and this is a heart of an adult, therefore the heart is way bigger. We always print 1:1 scale to show the sizes, the actual dimensions of the heart and of the model. So first, this is what we call an anatomical model of the whole heart and vessels. Another tumor. This was an old hemorrhage, and there is an aneurysm here that is surrounded by the hemorrhage, and the model was done to plan surgery again or interventional treatment, and finally it was done interventionally because surgical approach due to the tumor would be way too risky. So to better plan the intervention, we then made another model that is empty inside. So this is only this part, the upper part, the area where the aneurysm is. And it was possible to introduce the devices, the catheters, from this side and from this side to decide from which approach the intervention would be done best. So the doctor that was doing the intervention could earlier kind of train the intervention on the model, and therefore the final intervention was done without any hesitation in a very short time, and with a successful closure of this aneurysm that we can see here, preventing further expansion and bursting of it. So this is a different model done in a semi-transparent material that shows you one of the devices that are used in our department to treat congenital heart diseases, and this is how the device is sitting inside the heart. And you can also simulate the process of closure of the treatment by inserting the device into the model in a way similar to how it's done during the procedure. So this is to close the defect in between the 2 atria. Obviously, this is not done by bare hands, but this is only to demonstrate how the process works. We use these models, like I said, to plan our treatments, to plan surgeries, to plan interventional procedures, but we also use those models later on to show off students how we do it and how complex different congenital heart diseases can be. Because even one congenital heart disease can have multiple varieties of anatomy, and it's very difficult to fully appreciate this variability just by words, by descriptions, or drawing schematics on the drawing board. So only by printing models of each patient and then comparing patients having seemingly the same congenital heart disease, but oftentimes very different anatomy, we can fully understand to which extent the cardiac surgeon has to prepare for its surgery and has to adapt surgical strategies during the operation, and why they take so long and why they are so risky. So this is another example of a neonatal heart. This is how small they are. And another example, they just barely take place in your hand. You can hide them in your fist. So this is how small they are. Students, I must say I was amazed how much appreciation and how much positive response we got from students after showing them the models, after doing 3D printed model-based education of congenital heart diseases. They literally all agreed that this is great help to understand the anatomy, to better understand congenital heart diseases, to understand the surgical procedures or interventional procedures. They agreed that this should be used in different departments to learn also other diseases and anatomy details of other regions. So as we can see, this has great potential for medical education, not only for surgical planning, and we're working hard to introduce it to other fields of medicine now. We're waiting for you in Medical University of Gdańsk. During the pandemic, the print lab was repurposed totally, and we had less patients, but totally different problems. In the early days, there was a lack of personal protective materials like simple face masks or the face shields. So students led by Marlon came up with an initiative to print those very much wanted and very necessary personal protective materials like the face shields and face masks. And it was a great success. It was a very big help in the early days. So I'll ask Marlon to talk more about the details of this process.
My name is Marlon Sos Lewis, and I was one of the students who were involved in trying to help along with the pandemic. And at the beginning of the pandemic, I know everyone hopefully remembers, everyone was quite scared about the whole idea of the coronavirus, and no one knew exactly how to protect themselves. We were very short on equipment. The hospital didn't have enough equipment. Healthcare providers didn't have what they needed to protect themselves or their patients. So what we decided to do was try to use the 3D printing process and the skills we learned from modeling these hearts to try to create PPEs, or personal protective equipment. And the nice thing about 3D printing is that it's a very modular process. It's very easy to iterate. And so what we initially did was something with a very simple design, which is basically you, and we ended up gluing a basic plastic sheet around this, which looked something like that, and that was our first step in designing process. So it was very simple to make, very easy to design, and what we decided to do was, it wasn't perfect. So what we ended up doing is, over the next few weeks, now this entire process, I think at the peak of the time of the pandemic, took about 4 months, but our design process was very quick. So going from something like this, we used the help of the internet. So lots of people at the time, we weren't the only ones doing this process, had their own ideas and their own concepts of how to build and create models or protective gear. So we we took those models and we printed it out to see which suited our problem best. And so we were able to create take the different designs that people created on the internet, change them a little bit to see how it suited our needs, and combine all the best features of each of those. And so as a result of combining all of those processes together, we were able to find something that all the doctors, or most of the doctors, agreed was the best design for them. And it ended up being just something simple like a pair of glasses that had a modular design in such a way that you could always replace the face shields as they would get worn out, and they were comfortable enough to wear constantly without having the tension of the headband. So as a result of the iterative process, we were able to design something like that for face shields. We also did something for the patients, or for people who required a more constant use of the face mask, because we didn't know that the simple face mask would be enough. At the time, we wanted something more protective, and the initial thing was something similar to this, but it was kind of a little bit complex and it wasn't perfect. So we ended up designing something like this. It looked kind of funny at this point, but we were able to put a filter paper on top of this, and essentially you'd wear it kind of like a mask. It wasn't perfect, but it worked perfectly at the time, and thank God we can use these now. These were a little warm and a little uncomfortable at the time, but it suited the purposes that we needed, and we were able to design custom ones per the patient, especially for pediatric patients. We didn't know how it affected younger, more critical patients, so we ended up making designs that change the profile of the mask in such a way that it would contour to the face of the patient. So each of them were designed specifically per patient. And luckily right now we aren't in need of something so complex, but at the time it was very useful. So thanks to the very quick iterative process that we're able to design, prototype, and create all these different models in a very short period of time, we were then able to use all these machines to basically create a farm of manufacturing processes. And luckily, eventually, Prusa came up with a very innovative design that everyone loved. So we then adopted their models and started printing their design. And with this, these are actually 4 different prints which are printed on top of each other, and they can easily be cracked and split apart. And essentially they kind of split apart, and these are just 4 face shields. So right now we don't have a need for any of this, but in the future, if there's any problem that we needed to solve, we were able to solve it. One of them being the ventilators. We were short on ventilators, so what we decided to do was split the flow for each one so each ventilator could be used for multiple patients. So we had designs that we ended up using for that. We also had problems with some of the earpieces that were required to measure temperature. So we designed models that would actually put sleeves onto the earpieces. So we ended up making stuff like that. So we also ended up making a makeshift ventilator. So the ventilator itself isn't perfect. We were just testing it out to see how good it was. And at the time we were very short on ventilators. So this thing works. It's a little bit scary at first. It's very loud and it's not perfect, but we were trying to see what we could do at that time. Now we know more, and we've learned a lot from this entire process. And thanks to the skills that we gained at that time, we're able to better ourselves with our knowledge of how to model things, how to go through the design process. And that's actually translated into better models for the patients and for our heart models. So there's a lot of great lessons that we learned at the time due to an unfortunate circumstances, but thankfully, it was a good learning experience for ours. So hopefully you don't have to go through something like that, but maybe sometime in the future, you'll be able to design and create your own models that you'll be able to create for yourselves. It's an amazing feeling to make something as kind of like a model on your computer and then have it print and then have it work. I'm not sure that some people have had that feeling in the past when you've used other material, but this is something a little bit different, and I hope that you'll be able to enjoy the experience yourself. Thank you.